So there have been changes coming to enrollment for Mass Health this year in 2023 that we want the folks at Manatee Community Health Center to explain to us, because things are kind of going back to the way they used to be before the pandemic. So we're going to welcome to the program today the Manager of Community Support Services for Manatee, Shirley Fajardo, and also Ken Moore is with us. Ken is the Senior Patient Navigator and also a Shine Counselor. So welcome to you both. Thanks for coming over.
Thank you. Thank you
so
for
much
having us.
Yeah, it's a pleasure. This is a big deal, Shirley. This is a lot of folks may not realize that things are going back to the way they used to be when it comes to Mass Health, right?
Yes, it is a big deal. So what's currently happening is that at the beginning of the pandemic, the federal government put in place a COVID-19 public health emergency. And as part of that, it put in place requirements for continuous coverage where there was a Medicaid protection. That means that individuals who might not have been eligible for Mass Health or maybe didn't complete their application and submit all the necessary documents were still able to maintain their coverage throughout the pandemic. And this started March 2020. This officially ended March 31st, 2023, and this means that starting April 1st of this year, Mass Health is going back to their usual renewal process.
Okay, so it doesn't necessarily mean that all of those people that were covered during the past 3 years are automatically not covered, right?
No,
Okay.
not at all. Yeah, so the Mass Health renewal process, they prefer an auto renewal system, which means that if they have all the necessary information for the household or the individual, they will just do the renewal and determine whether the member is eligible for the benefits, whether it needs to be increased, decreased, or if they need to be terminated.
Okay.
If they do not have sufficient information, then they request documentation to be submitted from the members themselves.
Okay. How does a member know if they have to take any action? You know, how will they be notified?
Through mail. They will
Okay.
be receiving a blue envelope, and it's
Okay.
really important to call it a blue envelope because that's the easiest way to know if it's a renewal
Okay.
paperwork that is in there.
Okay.
They get that documentation asking them to renew, and they have 45 days to respond.
Okay. If they don't get a blue envelope, can they just assume that they're all set?
So for the people who Mass Health is able to auto renew,
Yep.
they will let them know via letter.
Oh, they will.
If they have been automatically renewed and can continue with the benefits.
Okay, so either way, the client will know
Yeah,
what
the
the status is with Mass Health.
Yes, they will know. It's just different color envelopes.
Okay. So I'm thinking, you know, for the past 3 years, there may have been folks that were never on Mass Health before that have been in it.
Yeah.
May not realize this is the process because
Right.
this is going to be new to them, even though it's the old way of doing things,
Yeah.
right?
Yeah.
Okay. You're having a special seminar to run through this right in person with folks, right?
Yes, we
Yes.
do. At Manatee, we have health insurance navigators who are certified through the Health Connector to provide health insurance counseling and enrollment assistance. And we're offering special sessions, navigation sessions for members of the community who need to renew their benefits, whether it is through Mass Health or in general through the Health Connector.
Okay. All right. And one of them is right here in Quincy, right?
Yes, and it is this Saturday,
Okay.
April 29th from 1 to 2. We're holding one here in our West Squantum location. It's
Okay.
110 West Squantum in Quincy, as well as our Taunton location, which is at 1 Washington Street in Taunton.
Okay. I think it's 9 to 2, right?
9 to 2, yes.
9 a.m. to 2 p.m. Okay. Okay. So Ken, will they see you there as well when they?
They will see me at the North Quincy location.
Okay.
Absolutely.
And what will you be doing for them?
I will be doing several things. Trying to help them, first of all, feel comfortable about the process because it's really going to be a surprise to a lot of people
Right.
and not really know what steps to take. So basically, I'm going to be explaining the process to them, letting them, filling out the paperwork for them, as well as collecting all the necessary documentation to get to Mass Health.
What should they be bringing with them?
Absolutely.
Yeah.
Identification is good.
Okay.
I would definitely say if they have income, a paycheck,
Okay.
if they're getting paycheck or if they're receiving Social Security, if they have something with their address on it, would be great. Sometimes driver's licenses, addresses change, or you can move and
Yep.
it's not the same address.
Yep.
So if they had a utility bill, light bill, cable bill, something of that nature,
Okay.
and basically from that point, we can submit that information. Now, if the person is, let's say, over 65, because this is going to help affect the senior population as well, maybe some people are just transitioning over to Medicare, they would need to maybe bring their Medicare card in so we could update that and their Social Security income if they're receiving Social Security or disability disability
Okay,
benefits.
all right. And you, as a Shine counselor, are keenly aware of that process.
Absolutely,
Yeah.
yes. I can definitely help people if they are on Mass Health at the moment,
Yes.
and if they're going to be getting off of Mass Health, maybe because they're turning 65 or any other reason.
Yeah.
I can help them figure out what their secondary to Medicare plan would be, and make sure that they have a prescription plan
Oh, okay.
in place, so they'll be all set.
All right, so you cannot be on Medicare or Mass Health at the same time? Is
Oh
it-
no, you can.
you can.
But when you turn 65,
Yep.
it's a little different. So Medicare becomes your primary, and
Yep.
then you can, depending on your income and assets, you could be eligible for Mass Health as a secondary to Medicare
Oh, all right.
as
Okay.
well. Yes.
Okay. And will you be able to do that at these sessions?
Absolutely.
You will?
Yes, if they bring their documentation with them
Yep.
in the blue envelope with them, I can help them with everything. Yes.
Okay, all right. Shirley, what if they've already gone past the allotted time for renewal? You know, is there any way to kind of to turn the clock back and fix that?
Yeah, so
There
if
is.
they haven't responded within the 45 days,
Yeah.
Mass Health usually communicates via mail.
Yep.
If you don't respond to the blue envelopes, you're at risk of your benefits being decreased
Yeah.
or terminated, which then means that Mass Health will send you a notice via mail that you haven't responded and
Yep.
your benefits will be terminated.
Okay.
And then you have an additional time frame to submit what was needed and try to avoid termination.
Oh, you do? Okay, all right. So it's not the end of the story there. You can still
Can
fix
I
it.
add to
But-
that if you don't mind?
Yeah,
There's
please.
always there's a but there. So usually, you would definitely have the 90 days time span to get Mass Health the information.
Yep.
If you don't, you will be subjected to termination. If you get Mass Health the information that they're asking for within the 90-day time frame, you will go back to your original renewal date. If you do not get them the information they're asking for within the 90 days, you will be terminated, and then when you start, it will start back from the day that you submitted the application currently. It won't go back to 2 or 3 months of the 90 days that they have given you.
Oh, all right. Okay.
So you don't want to have a gap in coverage, so
No,
that way
right.
we want to try to get them as much information as possible.
Right,
So-
because if you've incurred a medical incident during that time, then you'd be liable for that.
You'd be liable for that, absolutely, and that's what we don't. That's what they don't want to happen.
Right.
Yeah. So they're really trying. Now there could be some people might find that they might have double coverage. Somebody might be eligible for the Health Connector, and they have to pay for the Health Connector by the 23rd in order to be on for the 1st of the next month. Once they get on that coverage, they could also maybe still have the Mass Health coverage until it totally goes away.
Okay.
So there might be an overlap
Yeah.
of coverage. They're trying not to make it happen, but
Sure.
it's, I guess, better to have more than none.
Well, right, yeah.
Yeah.
You don't want to be uncovered, at
Absolutely.
any point. So if someone's not eligible for Mass Health, could you help them with the Health Connector?
Oh, absolutely.
can?
Yes, I can go right into, I can help them fill out an application online
Okay.
through the mahealthconnector.org.
Yeah, yeah.
And I can put in all of their information and give them a determination right then and there if they're necessary for a Connector Care plan or a Health Connector plan.
Okay. And what's the difference between the two, Ken?
Sure.
Yeah.
So if somebody's not eligible for Mass Health, they could be eligible for a Connector Care plan.
Okay.
A Connector Care plan is a health insurance plan that's subsidized with tax credits and subsidies to keep the premiums for consumers lower. So with that, they could have plans that can range anywhere from $0, maybe up to $100 or a little bit more than that.
Okay.
A Health Connector plan are unsubsidized, and if for people whose income is a little higher than the 300% of the federal poverty level, then they would still be able to get insurance through the Health Connector. Great plans, but they would have higher premiums and also deductibles.
Okay. Oh, and those would come from private insurance companies, is that right?
Oh, through the Health Connector, though. Yes.
Okay. So it's different from the state provided.
Yes.
Okay. Okay.
It's a lot.
It's
a
a
lot,
lot.
but we're definitely there to help you, guide you through everything.
And that's the key, really, is you need somebody that knows the system in order to to guide them through,
Right.
for
Yes.
sure. Yeah. So, in terms of who's eligible to come to these informational sessions, is it just clients, or is it no? It's
No,
just anybody?
no, it's open to anybody in the community who needs help at this
Okay,
time.
all right.
Yeah, we're trying to reach out to anybody under 65 or anybody over 65. Actually, anyone who receives the blue envelope.
Okay.
And it could be from now, April 1st, and it's this whole renewal process is going to be a 12-month time span.
Oh.
So some people might receive envelopes right now.
Yep.
Some people might receive them in the summer. Some might receive them in the winter. So they don't really have to take any action until they receive the blue envelope.
Oh, okay. What if they are eligible to receive a blue envelope but don't get one?
If they don't receive a blue envelope after the 12-month time,
Yeah.
then they are definitely able to come in and update all the information with Mass Health at any time.
All right.
The reason that they don't want people to come in sort of ahead of time of
Yeah.
the blue envelopes is because, let's say, if somebody's income is much higher and they're not going to be on Mass Health anymore,
Yep.
if they change it now before they get the envelope, it could be maybe 6 months before they would have gotten that envelope.
Oh, I see.
So it's going to be a big change from not having to pay to maybe having to pay for a health insurance plan.
Right.
That they're trying to just give everybody time to prepare for it and renew at the proper time.
Okay. So Shirley, is this typically the way the process works? Pre-pandemic, is this pretty much how it works?
Yes,
It is.
pre-pandemic, everyone had to renew every 12 months.
Oh, all right.
And the blue envelope is not a new process
new.
for Mass
Okay.
Health. So people who had it prior to the pandemic should be used to the process. I think it's been 3 years since we've done this
Right,
this
exactly.
way.
Yeah, so it may be new to some people.
Right, yeah.
Huh. What other types of communication will they be getting from Mass Health?
There is a lot of active outreach happening right now for the
Okay.
same reason that this might be new to some people, and even people who had it before, they haven't had to go through this process in a while. So Mass Health specifically, they are reaching out people via text, email, mail.
Okay.
Different health centers, organizations that have certified navigators are reaching out to people all sorts of ways as well. At Manet specifically, we have our navigators who are making personal phone calls to all of
Oh, really?
our
Okay.
individuals that we have helped with health insurance in the past to let them know about the renewal process. We have sent text campaigns as well as mailings out for the families that we have assisted in the past.
Yeah, okay. Are appointments necessary? Do they need to make an appointment, or can they just show up at this particular event?
You can make an appointment or
Okay.
you can just show up. We
Okay.
will accommodate anyone who needs assistance for navigation.
Okay.
Appointments are nice because you know when your time will be to come in and meet with a navigator.
Sure, yeah.
But if you don't get around to calling the health center to schedule an appointment, you're more than welcome to just
Still
stop
okay?
by.
Okay. And about how long does the whole process take?
It really depends. It depends
Yeah.
on how many people are in the household, what
Oh.
documents need to be submitted. We have situations where a navigator might be able to complete something in 30 minutes.
Mm-hmm.
We have situations where it might take a full hour for the appointment.
Okay. And if there are children that are also part of the coverage, do they need to come as well to the renewal process?
Just the head of household
Just the head
needs
of
to
household.
attend, yeah.
Okay. All right. Anything else we should let folks know about right now, you think?
Just please feel free when you get that blue envelope just to contact somebody at any Manet location. Or if they can't get to somebody at a Manet location, they can reach out to Mass Health directly. They're helping people over the phone. It's just numerous ways that we can help them. So
Okay.
just please reach out.
And as a Shine counselor, do you have separate kind of office hours that you keep for the Shine program as well?
Tell you the truth, they're all in one. So if somebody
Okay.
books an appointment with me, they can see me for anything Shine or navigation.
Okay, all right. So you are a key person.
Oh, yes.
Yes, he is.
Sure.
Yeah,
You
and-
mentioned, I'm sorry, go ahead, Shirley.
I just wanted to point out
Yeah.
too that in addition to the session that we're having on Saturdays,
Yeah.
we offer navigation throughout the week on a weekly basis
Okay, I was gonna ask
at
about that,
most
yeah.
of our locations.
Okay.
So if you're not able to attend this upcoming Saturday, that doesn't mean that you cannot receive navigation assistance.
Mm-hmm.
You can just call the site or stop by a Manet location, and we typically have a navigator on site, especially in our West Squantum location.
Mm-hmm.
And then our other 4 locations, we have navigators who do a few days a week out of those locations as well.
Okay, yeah, on C Street and House Neck, right?
Yes.
Bicknell Street in Germantown. Also in Hull, Taunton, and Attleboro.
And Attleboro, yes.
Manetchc.org, I know, is the main website,
Yes.
good place to go. Is there a good kind of main phone number that folks could call?
We
Or is
do
it different?
have our, they can call the main number in North Quincy, which
Okay.
is 617-376-3000, or they can call our navigation hotline at 857-403-1557.
Excellent. All right. Anything else?
We look forward to seeing them.
Right.
Yes.
I guess the message is don't ignore the blue envelope, right?
Don't ignore the blue
Absolutely.
envelope.
Yeah.
Yes.
And even if they don't receive it and they have any questions,
Yep.
just feel free to reach out.
Yeah.
Okay. All right. Thank you both. Really appreciate the
Thank you
opportunity.
very much
Thank
for
you.
having us. We
Very
really
welcome.
appreciate it.
Sure, happy to help. And thank you for watching us here at AM Quincy. I'm Joe Catalano. Please join us again next time.